I'm Marcus.
I'm Benji.
I'm Brenda.
I'm Melissa.
I'm Michael.
I'm Stephanie.
And this is our presentation on the syndesmosis ankle sprain.
Okay, so what is a syndesmosis ankle sprain? Syndesmosis or high ankle sprain is one that involves the ligaments binding the distal tibia and fibula at the distal tibiofibular syndesmosis. Injuries can occur with ankle motion, but the most common motions are extreme external or dorsiflexion of the talus. The dome of the talus is wider, and these movements force apart the medial and lateral aspects of the mortise, respectively the tibial and fibular malleolus. Okay, so the next slide is how does a syndesmosis ankle sprain occur? Syndesmotic ankle sprains commonly occur to athletes participating in American football and downhill skiing. Football injuries are usually a result of forced external rotation of the foot while the athlete is prone, as in the bottom of a pile. The injuries can result from a blow to the lateral knee while the foot is planted and dorsiflexed, resulting in an eversion or external rotation moment at the talocrural joint. Research has documented that syndesmosis injuries account for 1 to 11% of all injuries. So incidence among professional American football players is reported to be much higher. So further research says it's up to like 29%. So this is the athlete overview. His name is Benjamin Buttons. He's a male, 21 years old. He's 175 pounds, 5'11", and a Division I football athlete. His position is a wide receiver, and he's currently a junior. On the next slide. So here's a scenario. So the case injury involves a collegiate athlete who is 21 years old, football player who suffered a syndesmosis ankle sprain during competitive play. The athlete is 5'11", as I said before, wide receiver who weighs about 175. During competitive play, the athlete was rushing down the field about 10 yards to come to a stop to receive the football pass. But unfortunately, after catching the ball, he got tackled and wasn't able to gain his footing correctly, causing him to sprain his ankle. He immediately fell to the ground in agony, and he wasn't able to place any of his body weight on his injured right ankle. He was carried off the field by healthcare professionals and was examined. The medical team diagnosed him with a syndesmosis ankle sprain after completing initial assessments and special tests. The next slide will discuss the evaluation process regarding the athlete's injury. So after diagnosing the athlete, we follow HOPS. Well, the first step is evaluation. So several questions regarding the injury were asked towards the athlete. Questions and statements are provided below. So the first one is, how did the injury occur? So the athlete responds, the injury occurred during a competitive football game while I was running a route on offense. I mean, it wasn't much information, but that's a brief summarization that he gave us. The next question we asked is, when did the injury occur? And the athlete mentioned the injury occurred when I landed from a jump, attempting to catch a pass thrown to me while running a route. As I came down, I got hit, and after that is where I felt the pain in my ankle. So the player really doesn't recall much from the contact hit that he received, but that's his response. So the next question is, did you hear anything pop or grating of the ankle? So the athlete's response was, I do believe I heard a pop, but it's hard to tell since there was so much commotion. And there was commotion. So the next one is, did you feel anything give out, pop, burning, or numbness? So the athlete's response was, once I landed on the ground, I felt intense pain. I tried to stand on it, but my ankle was fatigued and it would give out. So I had to be helped off the field during the game. The next question asked was, what have you done for ice and heat over the time period you met a healthcare professional again? So the athlete's response was, I've been doing rice with my ankle until I met a healthcare professional, as I said before, and I tried to stay off of it as much as I could. So the athlete did pretty much any other person would do in a common ankle sprain. So the type of location of the pain was another question, and the athlete said that the pain is on both sides of my ankle, but it hurts more on the inside and top part of my ankle. It hurts when I move my foot towards my body, if that makes sense. So the athlete really didn't give a great explanation of his injury. He kind of gave us just a broad summarization of how his ankle feels. So based off of that information and other healthcare professionals' results, we were able to diagnose him with a syndesmosis ankle sprain. So this evaluation of HOPS continued. So the next assessment in HOPS is observation. So the healthcare professionals should have their undivided attention toward the athlete and jot down any key details regarding his injury. The healthcare professionals should be aware of any discomforts that the athlete may have regarding their injury in order to prevent further harm to the athlete. So here's an athlete's statement. So during the game, once my ankle gave out by the hit from the opposing player, I heard a popping sound as I landed. I knew my ankle wasn't in good shape. I couldn't stand on it at all. And as you can see, it's still very swollen. It has discolorations and bruising on both sides of my ankles. My ankle mobility is very limited and painful since the injury occurred recently. So, a continuing evaluation of HOPS continued is the next step in HOPS is palpating the injury. Palpating the area will give the healthcare professional a physical examination and test the athlete's performance and capabilities and physical appearance. So while palpating, the healthcare professional should not put the patient in any further injury. So make sure palpations aren't surpassing the pain tolerance of the athlete. So continue on. So the evaluation continued is the last step in HOPS is special tests. The healthcare professional will use multiple tests regarding the athlete's injury to determine their mobility and capabilities in determining the rehab program for the athlete. And here are a couple of the special tests, so the palpation test, the external rotation, the squeeze test, the dorsiflexion compression test, and that will be explained as follows.
So one of the tests we're going to be doing is the palpation test for the ankle. It involves carefully palpating over the area, which is the anterior tibiofibular ligament. And a positive test indicates if there's pain reported when the pressing of the ligament occurs.
So the beginning of your special test process, you want to go ahead and tell the athlete what they're going to test for. You're going to go ahead and palpate over the swelling carefully because the athlete could be in severe pain once the injury has occurred. You also want to ask questions throughout the testing process and look for facial expressions to see if the athlete is sensitive in certain areas. Depending on the areas the athletic trainer palpates can determine a positive test of which it originated.
The next test we're going to be doing is the external rotation of the ankle. The patient will sit supine on the bed, and external rotation test is performed by applying a passive external rotation stress to the involved foot and ankle with the knee held at 90 degrees and the ankle in a neutral position. A positive test is indicated when the pain over the area of the syndesmotic ligament occurs.
We found it easier for the patient and the trainer to have the athlete sit with the knee hanging at a 90-degree angle. The athletic trainer actively externally and internally rotates the ankle while supporting the talus. Positive test is indicated if pain is recreated in the syndesmotic region.
Another test we'll be doing is the squeeze test of the ankle. This one is just manually compressing over the fibula and tibia above the midpoint of the calf. A positive test is produced over the pain area of the syndesmotic ligament.
Before performing any special tests, make sure the athlete is relaxed to ensure greater plausible outcomes. Get yourself in a position for a greater reading. The athletic trainer should apply pressure to both the tibia and fibula while supporting the lower extremity during the test. Do so without causing further harm to the athlete.
And the last test we'll be doing is the dorsiflexion compression test. This is performed with the patient standing and actively dorsiflecting to stimulate a normal loading of the systematic ligaments. The patient will dorsiflex unassisted once and then once with the athletic trainer by applying a manual compression supporting around the malleoli. So the positive test will indicate if there's a significant increase in ankle range of motion with added compression and a decrease in the end of range pain and added compression.
You'll have the athlete dorsiflex as you observe the range of motion. Once recorded, you'll have the athlete relax and apply pressure to the malleoli while having the athlete dorsiflex again. If range of motion increases, it's a positive test.
So the MRI confirmed that the athlete has ankle syndesmosis break, the date of the surgery has been scheduled, and the athletic trainer will give a protocol treatment rehab plan before surgery. So to kind of minimize swelling, pain, and mobilization before surgery happens. I kind of already went through this. Benjamin Budden's gonna follow the athletic trainer's protocol treatment plan over trying to get him ready for surgery. We chose to do a tightrope repair instead of the dialysis screws repair because we just want to have a faster recovery, and the tightrope repair allows for normal biomechanical movements and a better anatomical reduction for the return to weight bearing, rehab, and sports activity. This is just like an overview of what the surgery is. Usually there'll be a plate laterally, and then the tightrope will go in between the two bones, so a needle will go through the bone, kind of drill into it, and then allow the tightrope to go through it, and then have the endo buttons on the side to kind of keep in place the tightrope repair.
So our goal for the beginning phase, which is the first 3 weeks of the rehab after surgery, is to protect the healing joint while minimizing pain, inflammation, muscle weakness, and loss of joint motion. So this is the first week. Basically, he's gonna be on the boot all the time. And then here's week 2. So he'll have towel stretching, some movement, a lot of icing going on. And then in week 3, we'll have more movement going on, more band exercises, balancing, stim, micro, Mark Pro, and some massages, and also contrast buckets. I'm going to be going into more detail about the rehab exercises in the rehab videos.
So here we have the athlete's sprained ankle. He will be putting on the boot for us in a moment. So there he is putting on the boot. The boot is for protection to help, since he just got out of surgery. The boot helps him his ankle stay stable, so that way no other re-injury can happen. And this will be for the first week. So here we have our athlete post-surgery. Already has gone through a week with the boot. We are slowly starting him off with our second week on the first day with some towel stretches. This is to help him get some motion back into his ankle since he's had it in a boot for a whole week. Stretching the muscle that supports your lower leg, foot, and ankle will help keep your ankle joint stable. By doing this, he will feel a slight greater range of motion in his ankle. He will do 3 sets of 30 seconds on each movement, on each stretch. He can do these on him. The athlete can do these by himself, or he can have a trainer to help him. Either way will be fine. Here we have our athlete being hooked up to electrical stimulation. Electrical stimulation is therapeutic treatment that applies electrical stimulation in treating muscle pain and spasms. So we'll hook him up here, and we'll put ice as well, the ice bag. The ice will help with the swelling and pain. So once we hook him up and we go to the intensities, we need to make sure that it is perfect for the athlete. The athlete shouldn't be feeling pain. So when you increase intensity, you always make sure you ask the athlete if they feel the shocks. And if he does, to tell us when to stop, because it has to be perfect for him or her. So this helps build strength if there's an injury involved, and it helps keep the muscle active since it's being contracted with the electrical stimulation. So this will be done after all his exercises, and it will be for 15 minutes. So here we have our athlete placing his foot, his ankle, in an ice bucket. This will be done on the second week, and a couple maybe on the first week, mostly on the second week. The ice bucket will be for 15 minutes. Now, moving on to the third week, he'll be doing a contrast, which is going from cold to hot. He just placed his foot in the hot. Now this contrast bucket, it would be done 3 minutes each temperature, and that will be one set, so 3 sets of those. A light massage is used to help reduce swelling and help move blood flow and other fluids needed for a quicker healing process. This will be done on the second week as well as the third. Throughout the process of his healing journey, a technique called cross-friction massage will be useful. So here we have our athlete on the bike. This will stand as a warm-up as well as a way for him to stay conditioned. Since he is hurt, he hasn't been able to do the same exercises he has before. So this will stand as a good workout warm-up that he will do every day or almost every day for 10 to 15 minutes. Our athlete here is doing some band exercises. This is somewhat like towel stretching, but with a little bit more of a resistance pull. He will be doing 4 type of band exercises, as it will be shown in the video. This will help him with his mobility, moving his ankle around, as well as strengthening the muscles in his lower leg, as you can see right there contracting. This will help him so when he goes back to play or back to his full potential, his muscles staying strengthened. We have our athlete doing some balancing work. This not only helps the ankle with stability, but as well as strengthening the rest of his muscles, especially his core muscles that he needs to do right here in this exercise. So now we have our athlete being set up on the game ready. We need to be careful with his ankle, because he is injured. So the game ready is active compression and cold therapy. So the game ready helps reduce pain and swelling, as well help reduce the cause of muscle spasms, and also help with oxygenated blood flow. So here it is for 15 minutes, the game ready. Our athlete here is being hooked up to the Mark Pro. The Mark Pro is an electrical muscle stimulation device. So it's that green thing that you see there, that one. So we hook him up and we will turn it on. We'll put it at the level that he or she, in our case it's a he, feels comfortable. Not too high of a level of a intensity and not too low. So this is used to speed up muscle recovery, enhance performance, and reduce chances of more injury. So this will be done for 15 minutes, mostly on week 3. So here we hooked up the athlete to microstimulation. Microstimulation is a safe and long proven therapy. It helps to control pain and speed the healing process in a safe and simple way. So here we have the intensity. He doesn't feel any shock, so usually we'll put it at 550. So here we have the athlete doing the contrast buckets as seen in the other video. The only difference between that video and this video is that he will be doing calf raises and squats during the time he's in those buckets. So he will be doing 12 reps of calf raises in the cold and in the hot, and then 12 reps of squats in the cold and in the hot. So the contrast bucket is to decrease pain and increase circulation in the area of injury and restricted blood flow. So the goal for this is to decrease pain, decrease swelling, decrease and control inflammation, improve mobility, improve muscle recovery after exercising. So this will be done after all his exercises, and these exercises included in there will be helping his ankle mobility as well and stability.
So week 4 through week 7 of the rehab process, our goal is to normalize joint modalities, straighten neuromuscular control, and return to basic function and activities of daily activity. So in week 4, ankle pumping, ankle alphabet, ankle circles, towel gatherings, elastic resistance, heel raises, standing, walking on toes, balancing. Our treatment focus is going to be stimulized and game ready. And for week 5, the intensity will go up a little bit with different exercises, like single leg balance on air cushion, wobble board point sitting, single leg resistant cord, and the treatment would be Mark Pro and Stiminize. And in week 6, we'll enter the process of biking and some compass reaches, single leg balance, and the treatment will be game ready, Mark Pro. And I will continue into detail more on those rehab exercises. Elastic resistance band exercise. While sitting, place a hand on top of the tibia for stabilization. Doing this exercise 3 times for 15 reps, working on dorsiflexion, plantar flexion, eversion, inversion motions. Ankle circles. Using your big toe as an indicator, make circles with your ankles first clockwise, then counterclockwise. Do this 3 times. Be sure that the motion is at the ankle and not just the foot. Ankle pumping exercise increase range of motion and circulation by first pointing your toes downward, then up in slow, steady motion. Repeat 3 times for 15 reps. Ankle alphabet exercise entails drawing the letters of the alphabet with the injured ankle and repeating the exercise 2 to 3 times a day. By drawing the letters, the ankle moves through all the planes of motions, up and down, side to side, rolling in and rolling out, and a combination of all of the movements together. This stimulates the movement patterns needed for walking and everyday activities. But because these are performed not weight-bearing, there is no excessive force being placed on the injured structure. The movement also enhances the circulation to the damaged tissues and assists in much needed awareness of joint position. Walking on toes exercise. Raise up on your toes and walk a distance for 2 times. Heel raises standing exercises. Raise up on your toes as far as possible from a standing position. Use a chair, back, or wall for balance support if necessary. Perform 2 sets of 20 reps. Towel gathering exercise. Sit in a chair on a non-carpet floor with a small towel spread out in front of you. Gather the towel as much as possible. Progress is often slow, so keep trying. Straighten the towel and repeat 2 times. Marble exercise. Sit in a chair with both feet in front. Scatter small pebbles of marbles so that it can be picked up with your toes. Place a mug slightly out in front of you and try to pick up the marbles with your toes. After picking up the marbles, grip with your toes and try to place them in the mug. This may be difficult at first, as some of the small stimulation muscles in your ankles may be weak. Try to pick up as many marbles as you can with one foot. Attempt to try to do this 5 times a week for 5 to 10 minutes. As your feet become stronger, increase the amount of time and frequency.
week 7, and this week is the week before we go to return and play protocol. So our rehab training is a little bit more advanced than the rest of them have been. We still have the same simple 4-way ankle rehab to start off the athlete getting warmed up, and then we have back support, all 4 sides, and we have Bosu wall squats, and we have weighted step ups. And next day we also have the same thing, 4-way ankle. Then we have wall squats with a yoga ball. We have heel toe monster walks. We'll show more in the video that we're gonna have Marcus present. We have heel raises, 3 sets of 15. We have jump rope for 5 minutes. 1 minute will be double unders, so it's a little bit more advanced jump rope. We have defensive slides. Going across the training room we have, and we also have the same thing, Wilson ball. We have monster walks, and we'll have Marcus show a little bit more on how he will do monster walks for rehab. And the rest of it's basically the same stuff we're gonna do. In the next slide, we're gonna show you our return to play protocol. protocol is when your athlete's already getting ready to go back into play, to the sport. Ours is football, so we're gonna do stationary bikes for his cardio, and we're gonna go getting used to catching some balls, tennis balls, and we're gonna do footwork drills, ladder drills, Vertimax ladder drills. We're gonna do resisted running with an athletic trainer. The L drill, getting ready for like more like specific movements he's gonna be doing in the football field. We're gonna do like all the drills he'll do in practice, but with nobody else around him and no contact.
One subnote, subjective. He still feels a little bit of tenderness along the syndesmosis. He was asked how much pain he was feeling at the time from a scale of 0 to 10. He said it feels around a 7 or a 6. It feels better since I had the surgery. He feels a little stiffness and pain while going through the ankle range of motion. He was asked how the pain was feeling. He said it feels like a sharp pain, but not as bad as when I got the injury. It's just an annoying type of pain that I can tolerate. The chief complaint, the swelling is bothering me a little bit along with the pain that I'm feeling. Objective, still a little bit of swelling around the right lateral malleolus and a little bit of swelling on the anterior portion of the ankle. There is limited edema found on the lateral portion of the ankle. Patient did struggle with some of the exercises at first, but caught on after some sets. Assessment, short-term goals, reduce pain sensation to 5.5 or lower by next week, reduce some swelling by next week as well, to increase ankle range of motion. Long-term goals, no pain or swelling by week 8, be able to participate in full weight bearing activities, no worry. The plan, soft tissue massage on the ankle to reduce swelling, rehab exercises to promote function and strength. The patient will be given anti-inflammatory medication to reduce pain. Week 2 soap notes, subjective. He's still feeling the tenderness through the syndesmosis. He was asked how much pain he was feeling at the time from 0 to 10. He said it feels like around a 6. It feels better than last week for sure. Patient feels a little stiffness and pain while going through ankle range of motion, but it's better than last week. He was asked how the pain felt. He said it feels like a sharp pain, but not as bad as last week. Pain is still annoying me though. The chief complaint, the swelling is bothering me a little bit along with the pain that I'm feeling. Objective, less swelling since last week around right lateral malleolus and on the anterior portion of the ankle. There was almost no edema found on the lateral portion. Assessment, short-term goals, reduce pain sensation to 5 or lower by next week. Also to reduce swelling by next week as well to increase ankle range of motion. Long-term goals, still the same as last week, to reduce pain and swelling by week 8 and to be able to participate in full weight bearing activities with no worry. The plan, soft tissue massage on the ankle to reduce swelling, also to continue with rehab exercises, and the patient will keep consuming the anti-inflammatory medication. Week 3 soap notes, subjective. He's still feeling the tenderness through the syndesmosis. He was asked how he was feeling the pain from a scale of 0 to 10. He said it feels like around a 5. It feels about the same but slightly better. Patient was asked how the pain felt. Still feels like a sharp pain, but I don't feel it as much as last week. Chief complaint, the swelling is bothering me a little bit along with the pain that I'm feeling. Stiffness before the exercises bothers me as well. Objective, less swelling since last week around right lateral malleolus and on the anterior portion of the ankle as well. No edema is found on the lateral portion of the ankle. Assessment, short-term goals, same as last week, to reduce the pain sensation to 4.5 or lower, reduce swelling as well, and long-term goals to have no pain or swelling by week 8, and for the patient to be able to participate in full weight-bearing activities. Plan is still the same: soft tissue massage, rehab exercises, and he will keep consuming anti-inflammatory medication. Week 4 SOAP notes, subjective, he's still feeling tenderness, but it's better than last week. Patient was asked how much pain he was feeling at the time, from 0 to 10. He said it feels like around 4. He was also asked how the pain felt. He said it doesn't feel as sharp as last week. I feel that the ice helps with the pain. Chief complaint, stiffness before the exercises bothers me. Objective, there's still some swelling around the malleolus and a little bit on the anterior portion of the ankle. We found out that this swelling is mainly because after the exercises are done, he starts to swell up more. There's still no edema found. And assessment, short-term goals, same as last week: reduce pain sensation to 3.5 or lower. Also to reduce swelling, to increase ankle range of motion. As we said, swelling on the ankle tends to reoccur after the exercise, so soft tissue must be done after. Long-term goals, still the same: no pain or swelling by week 8. Be able to participate in full weight-bearing activities with no worry. Plan, soft tissue massage, rehab exercises, and the patient will keep consuming anti-inflammatory medication. Week 5 SOAP notes, subjective, he's still feeling tenderness through the syndesmosis, but it's getting better every week. Patient was asked how much pain he was feeling. From 0 to 10, he said it feels like around a 3. He says he almost feels no pain. Patient was asked how the pain felt. Pain doesn't feel sharp, it feels more sore than painful. The soft tissue massage has been really helping it a lot. Chief complaint, I just feel sore. Objective, there's still a little bit of swelling around the lateral malleolus and in the anterior portion of the ankle. Swelling still occurs from after the exercises, but the soft tissue and ice has shown to reduce it. There is still no edema found. Assessment, short-term goals, same as last week: to reduce the pain sensation to a lower. Keep progressively reducing the swelling by next week. Swelling on the ankle tends to recur after the exercises, so soft tissue must be done after, along with ice and stem. Long-term goals, the same as last week: no pain or swelling by week 8, and to be able to participate in full weight-bearing exercises with no worry. The plan is still the same: soft tissue massage, ice and stem after rehab exercises, and to continue with rehab exercises to promote function and strength. He will still keep consuming the anti-inflammatory medication. Week 6 SOAP notes, subjective part: almost no tenderness due to syndesmosis. He was asked how much pain he was feeling at the time, from 0 to 10. He said it feels like around a 2. I basically feel no pain. Patient was asked how the pain felt. I really don't feel any pain right now. It still feels pretty sore, but it's getting better. The soft tissue massage has been helping. Chief complaint, mostly soreness. Objective, the swelling is pretty much gone around the right lateral malleolus and the anterior portion of the ankle. It still occurs after the exercises, but the soft tissue and ice has shown to reduce it. There's still no edema found. Assessment, short-term goals, the same: reduce pain sensation. Also, to continue with the ice and stem and soft tissue after the rehab exercises. Long-term goals, same as last week: no pain or swelling by week 8. Plan, soft tissue massage to reduce swelling, ice and stem after rehab exercises, to continue with the rehab exercises, and patient will keep consuming anti-inflammatory medication. Week 7 soap notes. Subjective. He is feeling almost no tenderness in the syndesmosis. He was asked how much pain he's feeling at the time from 0 to 10. It still feels like around a 2. It still feels the same as last week, but I basically feel no pain. He was asked how I felt. Same as last week, mostly sore. Chief complaint, mostly soreness. The swelling is gone, but it continues to reoccur after the exercises, so soft tissue and ice has shown to help it. There's still no edema found. Short-term goals, same, reduce pain sensation, reduce swelling as well with ice and stem after the exercises. Long-term goals, no pain or swelling by week 8. Plans, soft tissue massage on the ankle to help with swelling, ice and stem after rehab exercises. Start weight-bearing rehab exercises to promote function and strength. And he will keep consuming anti-inflammatory medication. Okay, return to play protocol soap notes. Subjective, no tenderness through syndesmosis. Patient was asked how much pain he was feeling at the time from 0 to 10. He says he feels no pain at all. Chief complaint, he still feels soreness after the rehab exercises. Objective, swelling is gone, and there's no swelling after the exercise, and there's still no edema found. The assessment, patient can now go through weight-bearing and physical activity, but still no physical contact. Plan, ice and stem after rehab exercises, weight-bearing rehab exercises to promote function and strength. Soap notes, subjective, during a football game, patient forcefully externally rotated his right ankle while it was in excessive dorsiflexion. Patient came limping off the sideline complaining of pain while he was weight-bearing on his foot. He said he feels pain on the anterior side of the ankle going up midway between the syndesmosis joint. He was asked how much pain he was feeling at the time from a scale of 0 to 10. He said it feels like a 9 and it hurts pretty bad. He was also asked how he felt the pain. He said it feels like a sharp pain whenever I move it or try to stand on it. The chief complaint, he said I can't stand or walk on it. It hurts too much. He was given 400 milligrams of ibuprofen for pain and inflammation. Soap notes, objective. There was severe swelling and discoloration on the anterior and lateral side of the ankle. The girth measurements of the ankle compared bilaterally show that the right ankle to be bigger than the left. There was edema buildup on the anterior portion and some under the lateral malleolus of the ankle. Palpation over the anterior portion of the ankle reveals to be tender along with palpation along the syndesmosis joint. The heat was shown over the swelling portion of the ankle. He had loss of function of the ankle and he felt the pain while it was in dorsiflexion and externally rotated. The assessment, our impression was that it was a possible syndesmotic ankle sprain. The problems he had, pain with movement, pain at rest, less range of motion, loss of function, and tenderness. He was positive for dorsiflexion compression tests of the tibia and fibula, positive for squeeze tests of the ankle, and positive for ankle external rotation tests. The plan, he has been scheduled for an MRI. The patient will use crutches to keep the weight off the ankle along with the ACE bandage and a walking boot brace. Price at least once a day or when swelling occurs. No physical activity will continue with anti-inflammatory medication until further information from the confusion and final release. Over the span of the weeks, the athlete has improved drastically from his injury. The athlete was able to complete the rehab program with ease, although there was a few complications due to his pain tolerance. The athlete showed to recover progressively through the rehab through the use of the modalities. The surgery ended up being a success, and by following the rehab program that was issued, brought the athlete back to pre-injury performance. As shown in the videos, you can see the athlete's progress through the weeks. It was a great learning experience for myself and my colleagues, and by having different ideas and approaches deciding how to treat the patient gave us the proper approach in rehabbing and aiding a syndesmosis ankle sprain.